As we grow older, even the simplest things like brushing our teeth, showering, or trimming our nails can quietly become more difficult. Not because we don't care, but because our bodies, routines, and energy change with time. And sometimes the very things we forget are the ones doctors and caregivers notice right away. In this gentle and honest video, we'll explore 7 common hygiene mistakes many seniors make, often without even realizing it, and what you can do to fix them easily and with dignity. Because staying clean isn't about appearance, it's about health, comfort, and self respect. Mistake number 1: not moisturizing dry, aging skin. It happens so slowly, you almost don't notice. One day, your skin feels just a little tighter after bathing. A week later, your shins start itching at night. Soon, your elbows are dry and flaky, and your heels crack with every step. You may think it's just age, nothing serious. But to a doctor or nurse, dry, aging skin is one of the first signs they notice, and if left untreated, it can lead to much more than just discomfort. It can lead to cracking, bleeding, infections, and even hospitalization. Let's explore why this happens and what you can do, simply and gently, to bring comfort back to your skin. Why seniors struggle with dry skin. As we age, our skin naturally produces less oil. The protective outer layer, called the epidermis, gets thinner and less elastic. On top of that, seniors often take medications that dry out the skin, bathe in hot water, which strips away moisture, live in dry environments with air conditioning or heaters, drink less water than their bodies need. All of this leads to a common but often ignored issue: chronically dry skin. It's not about vanity, it's about your body's first line of defense, your skin. Healthcare professionals are trained to notice what others miss. When a doctor sees a senior patient, one of the first things they look at is the skin: shiny, flaky legs, likely under-moisturized, red or cracked heels, infection risk, dry elbows or arms, signs of dehydration or lack of care. Open skin tears could be prevented with better skin protection. Sometimes what seems like a small patch of dryness to you is a signal to a doctor that your overall self-care might be slipping, not because you don't care, but because aging makes these habits harder to maintain. Moisturizing daily isn't just about comfort. It helps with preventing skin infections, reducing itching and inflammation, soothing joints and pressure points, making you feel cared for and confident in your own skin. And most importantly, it creates a moment of gentle self-respect in your day. You don't need expensive products or complicated routines. Just a few small changes can make a big difference. Use a fragrance-free moisturizer made for sensitive or aging skin. Apply immediately after bathing while the skin is still slightly damp. Focus on legs, arms, elbows, and feet, the driest zones. Use soft socks or gloves overnight to lock in moisture. Keep lotion in easy-to-reach spots, like by your bed or bathroom sink. And if your hands tremble or you forget, ask a loved one or caregiver for help. There is no shame in needing assistance, only strength in accepting it. You've carried this body through decades of life, through joy, grief, work, and rest. Now your skin is asking for a little extra kindness. So the next time you reach for a towel after bathing, reach for your lotion too. Not because you're trying to look younger, but because you deserve to feel cared for. Every day, in every little way. Mistake number 2: neglecting oral hygiene and dentures. It's easy to overlook. You've brushed your teeth for decades, you know the routine, morning and night, but lately you forget, or maybe you just don't feel like it. Your mouth doesn't feel dirty, you're not eating as much, and besides, you don't have many teeth left, so what's the point? Here's the truth most people don't talk about: oral hygiene becomes more important, not less, as we age. And doctors, especially geriatric specialists, notice right away when it's being neglected. There are many quiet reasons why oral hygiene slips in older adults. Arthritis or hand tremors make brushing harder. Cognitive decline leads to forgetfulness. Depression or fatigue reduces motivation. Wearing full or partial dentures can give a false sense of cleanliness. Some medications cause dry mouth, which increases bacteria and infection risk. And sometimes there's simply no one around to remind you gently: have you cleaned your teeth today? What starts as "I'll brush later" can quietly become days without proper care. Healthcare professionals are trained to spot subtle signs of poor oral hygiene: dry, cracked lips or tongue, bad breath that isn't explained by food, inflamed or bleeding gums, denture odor or visible plaque, sores, fungal infections, or loose teeth. These aren't just cosmetic issues. They can signal underlying health problems and lead to gum disease, tooth loss, oral infections that spread to the bloodstream, difficulty eating or digesting food, even malnutrition in severe cases. Many seniors think dentures don't need regular cleaning, but unclean dentures can cause odor and embarrassment, lead to yeast or bacterial infections in the mouth, cause inflammation of the gums or pain when chewing, build up plaque, just like real teeth. If dentures are part of your life, they need just as much care and attention. Here's how to maintain a clean, healthy mouth, even with aging hands or limited energy. Brush natural teeth at least twice a day using a soft toothbrush. If using dentures, remove and clean them daily with a denture cleaner. Rinse your mouth after meals, even if you don't eat much. Use mouthwash or saltwater rinses to reduce bacteria. For dry mouth, try sugar-free lozenges, xylitol gum, or sipping warm water. Visit a dentist at least once a year, even if you have full dentures. Ask for help from a caregiver if brushing becomes physically difficult. And if you feel discomfort, bleeding, or changes in taste, don't wait. Tell your doctor or dentist. These signs matter. Your mouth is where you speak love, where you smile at your grandchildren, where you enjoy food, laughter, and memory. It deserves your care. Taking care of your mouth isn't just hygiene, it's an act of dignity, health, and self respect. So even if it's harder now, take one small step today. Brush, rinse, smile. You're worth it. Mistake number 3, ignoring ear and nose care. They're small, they're quiet, and most of the time we don't think about them at all. But your ears and nose, two of the most overlooked parts of your daily hygiene routine, play a much bigger role in your health than you might realize. And when they're not cared for properly, doctors notice immediately. A little wax, a little dryness, a little congestion may seem harmless, but over time it can lead to hearing loss, infections, and even falls or confusion. Let's take a closer look at why ear and nose care becomes so important with age, and how you can gently take better care of these often ignored areas. Many older adults unintentionally skip ear and nose care for simple reasons. Mobility issues make it harder to clean thoroughly. Dry environments or medications dry out nasal passages. Reduced dexterity makes tasks like trimming or rinsing difficult. Fear of damaging the ears leads to total avoidance. Hearing loss creeps in gradually, making it hard to notice the impact. Some think, it's fine. I've lived this long without worrying about it. But aging brings real changes. Earwax thickens and becomes harder to clear. Nose hair grows more visibly and may become uncomfortable. The inner lining of the nose dries out, cracking and bleeding more easily. Your sense of smell may dull, affecting taste and appetite. These changes are common, but that doesn't mean they should be ignored. When a doctor examines an elderly patient, they often check the ears and nose first, especially if the person reports trouble hearing, dizziness, headaches, unexplained fatigue, reduced appetite or sense of taste. Here's what they might see: earwax impaction that's blocking sound, ear infections from buildup or moisture, nasal dryness or scabbing inside the nose, excess nose hair, which can trap dust and bacteria, signs of mouth breathing, leading to poor oxygen intake. These may seem like minor issues, but for seniors, they can snowball quickly into balance problems and falls, miscommunication due to hearing gaps, higher risk of respiratory infections, less interest in food due to muted smell and taste. Caring for your ears and nose doesn't have to be complicated, just consistent. For ears, wipe the outer ear gently with a damp cloth. Never insert cotton swabs or sharp objects into the canal. If hearing seems muffled, ask a doctor to check for wax impaction. Consider annual hearing checkups, especially after 70. Use a hearing aid. Clean it daily with a soft cloth. For nose, use a saline nasal spray to keep passages moist, especially in dry climates. Gently trim visible nose hairs with rounded tip scissors. Avoid picking or scratching the inside of your nose. If frequent bleeding occurs, talk to your doctor. It may signal deeper issues. Inhale steam from a warm shower or bowl of water to soothe dryness naturally. These steps take only minutes, but they help protect two vital senses: hearing and breathing. You've listened to stories, you've breathed in a lifetime of memories, from fresh morning air to your grandchild's laughter. Your ears and nose aren't just features, they're how you connect to the world, and they deserve your attention. So take a moment each day, clean gently, moisturize if needed, And remember, this is not vanity, it's dignity. Mistake number 4, poor foot hygiene and nail care. Your feet have carried you for decades, through long workdays, family vacations, hospital visits, weddings, and quiet walks in the garden. They've been your most loyal companion, even when you barely notice them. But as we age, our feet become the most neglected part of our body, and doctors notice it immediately. Dry skin, thick toenails, odor, swelling. These are not just cosmetic issues. They're quiet warnings that your feet are asking for more care. Let's explore why foot hygiene becomes harder with age and how to give your feet the gentle attention they deserve. For many older adults, taking care of the feet becomes challenging for several reasons. Limited flexibility makes it hard to reach the feet. Weakened eyesight makes trimming nails safely more difficult. Thicker, slower growing toenails are harder to cut. Neuropathy or poor circulation reduces sensitivity. You may not feel pain or dryness until it's serious. Some simply think, no one sees my feet anyway, but your doctor sees, and what they often see is preventable damage. When a doctor examines your feet, they look for thick yellowed toenails, possibly fungal infections, cracked heels or dry soles, risk of skin tears or infections, odor or swelling, potential poor circulation or hygiene lapses, redness or sores, early signs of ulcers, especially in diabetics. Long curled nails can dig into the skin, causing pain or wounds. Signs of imbalance or gait issues due to painful feet. What seems like a minor issue can escalate into infections, falls, chronic pain. In severe cases, hospitalization or even amputation, especially with diabetes. Good foot hygiene doesn't require fancy products, just gentle, consistent care. 1. Wash and dry daily. Wash your feet with mild soap and warm water. Dry thoroughly, especially between the toes, to prevent fungus. 2. Moisturize the soles and heels. Use a fragrance-free lotion. Avoid applying between toes. Moisture can cause fungal growth. 3. Trim nails carefully or get help. Use nail clippers with a wide grip. Cut straight across, not too short. If you can't do it safely, ask a family member or podiatrist. 4. Check your feet weekly. Look for any changes in color, swelling, or small wounds. Use a mirror or ask someone to help if you can't see the bottom. 5. Wear clean, breathable socks and comfortable shoes. Change socks daily. Avoid tight shoes or walking barefoot indoors to reduce risk of injury. 6. Soak feet occasionally. Warm water with Epsom salt can soothe soreness and soften nails, but avoid soaking too long or too often, can dry the skin. Your feet may be the furthest from your heart, but they're closest to the foundation of your health. Every step you take depends on how you care for them, and every moment of comfort starts from the ground up. So be gentle, be regular, and remember, your feet deserve gratitude, not neglect. Mistake number 5, wearing the same clothes repeatedly. You wake up in the morning and reach for the same cozy sweater. That pair of pants by the bed feels just fine. Your house is quiet. There's no special occasion, so why not wear it again and again? Maybe you forget how long it's been. Maybe laundry feels too tiring. Maybe honestly, it just doesn't seem important anymore. But here's what many people don't realize. Wearing the same clothes day after day, even if they still look clean, can quietly affect your health, your hygiene, and even how others perceive your well being. Doctors notice it, caregivers notice it, and most importantly, your body feels it too. For many older adults, there are very real reasons why outfit changes become less frequent. Fatigue or limited mobility makes changing clothes physically harder. Memory lapses can cause you to forget when you last changed. Living alone can reduce the motivation to dress up or feel fresh. Depression or low mood may lead to wearing the same outfit for comfort. Laundry routines can feel overwhelming or difficult to manage. You're not being careless, you're simply adapting, but maybe not in the healthiest way. Wearing the same clothes repeatedly, especially without washing them, can lead to several subtle but serious issues. Body odor, especially in warmer areas like underarms or the groin. Skin irritation, rashes, or infections due to bacteria or trapped sweat. Fungal growth, especially if socks, undergarments, or pants stay damp. Stained or worn fabrics that may signal declining hygiene to others. Lack of self-care that might point to depression or cognitive changes. Sometimes, the way someone is dressed tells doctors more than their words. It's not about fashion, it's about function, cleanliness, and dignity. Here are some simple ways to stay clean, fresh, and confident without making things harder. 1. Create a simple clothing rotation label hangers Monday, Tuesday, etc. to avoid repetition. Set out outfits in advance with help if needed. 2. Focus on undergarments. First, change underwear, socks, and undershirts daily, even if outerwear is reused. These items collect sweat and bacteria fastest. 3. Choose easy to wear fabrics. Soft, breathable clothes that are easy to put on and take off. Avoid tight sleeves, heavy layers, or buttons if dexterity is limited. 4. Ask for laundry help if needed. Family members, caregivers, or community services can assist. Set a regular laundry day so it doesn't build up. 5. Make freshness a ritual of self respect. A clean shirt, a fresh pair of socks, a light fragrance or powder. These small details don't just change how you look, they change how you feel. Your clothing holds more than just warmth, it holds the energy of your day. And changing into something clean isn't about impressing others, it's about honoring yourself. You are still worthy of care, you are still worthy of freshness, comfort, and dignity. So, tomorrow, when you reach for what's familiar, maybe try something fresh instead. Not because you have to, but because you deserve to feel renewed, even in the smallest ways. Mistake number 6, infrequent bathing due to fear of falling. Bathing should be refreshing, a way to reset, feel clean, and relax. But for many seniors, the bathroom, especially the shower, becomes a quiet source of fear. Not because of water, not because of laziness, but because the simple act of stepping into the tub feels like stepping into danger. And so, bit by bit, bath days get skipped. Once every 2 days becomes once a week, becomes only if I really have to. Doctors and caregivers notice this right away, not just by odor, but by skin changes, infections, and emotional cues. Let's talk about it gently, honestly, and find a better way forward. After 70, many seniors quietly struggle with balance and confidence in the bathroom. Slippery tiles, weak knees or legs, trouble stepping over the tub, dizziness from bending or standing too long, fear of being alone while bathing. Past trauma, a fall that once happened and was never forgotten. These fears are valid, they're not imagined. And when no solutions are offered, many elders choose what feels safer. I'd rather skip the bath than risk falling. When bathing becomes infrequent, the body shows signs. Body odor, especially in hard to reach areas. Dry, flaky, or irritated skin from buildup of sweat or bacteria. Rashes, especially under breasts, between thighs, or under arms. Urine or fecal residue, leading to infections or sores. Matted hair or greasy scalp. A general appearance of not feeling well, because hygiene affects dignity too. But doctors don't just see symptoms. They see someone who's silently managing fear and perhaps ashamed to ask for help. Bathing doesn't have to be scary. With a few small adjustments, it can become safe, calming, and even enjoyable again. 1. Install safety features in the bathroom. Grab bars near the toilet and inside the shower, non-slip mats or textured strips, a shower bench or seat so you can sit while washing. Handheld shower head for easier control. 2. Consider a sponge bath, alternative on off days. Use warm washcloths to gently clean underarms, groin, feet, and face. Keep supplies nearby for ease. Add a few drops of lavender oil or gentle soap for comfort. 3. Ask for help. Without shame. A trusted family member or caregiver can assist. Choose someone who respects your privacy and dignity. Modesty is honored best when paired with compassionate support. 4. Create a bathing routine that works for you. Schedule it during times when you feel strongest, morning or midday. Make it peaceful. Soft lighting, warm towels, soothing scents. Celebrate it as an act of care, not a chore. You don't need to prove your independence in the shower. You don't need to suffer in silence. And you are not weak for being cautious. You are wise for listening to your body and brave for finding safer ways to care for it. Cleanliness is not just about how you smell, it's about how you feel in your own skin. So whether it's a full shower or a sponge bath, remember, you deserve to feel safe, fresh, and respected every single day. Mistake number 7, not wiping or cleaning thoroughly after using the toilet. It's something no one likes to talk about, something most people assume just happens naturally. But as we age, even private, automatic habits like wiping after using the toilet can quietly become difficult and easily overlooked. Not out of neglect, not out of laziness, but out of something much deeper, um, mobility, pain, or simply not wanting to ask for help. And yet, this is one of the first things doctors and caregivers notice immediately, because poor hygiene in this area can lead to discomfort, odor, infections, and serious health complications. Let's explore this gently with respect and care. Many seniors silently struggle with thorough cleaning after toileting for reasons that are physical, emotional, and practical. Arthritis or stiffness makes reaching around difficult, obesity or decreased flexibility limits range of motion, Parkinson's disease or tremors affect hand control, cognitive decline causes forgetfulness or confusion about proper hygiene steps, shame or embarrassment prevents asking for help, fatigue or urgency makes people rush, and so little by little wiping becomes inconsistent, sometimes missed altogether. Medical professionals are trained to gently observe hygiene related clues, strong odor even shortly after toileting, skin irritation around the buttocks or perineal area, redness, rashes, or sores, urinary tract infections, UTIs, especially in women, fecal residue on clothing or underwear, discomfort sitting or walking due to soreness. These signs don't mean someone is unclean. They're signs that someone may need support, tools, or compassion. Because the truth is, no one wants to feel dirty, and no one wants to admit they're struggling with something so personal. There are many respectful ways to help seniors stay fresh and clean without shame. 1. Switch to wet wipes or moist toilet paper. Easier to grip and use. Clean more thoroughly than dry tissue. Soothing to sensitive skin. Choose fragrance-free, alcohol-free wipes. 2. Use a handheld bidet or bidet attachment. Gentle water rinse reduces need for wiping, helps prevent irritation, can be installed affordably in most homes, especially helpful for arthritis or limited mobility. 3. Install grab bars in the bathroom. Help stabilize the body during cleaning, reduce falls, and build confidence. Allow for safer repositioning on the toilet. Practice perineal hygiene during bath time. If wiping is difficult, make cleaning part of your shower or sponge bath routine. Use gentle soap and warm water, pat dry completely to avoid moisture buildup. 5. Don't be afraid to ask for help. Some seniors require caregiver support, and that's okay. Choose someone you trust who treats you with dignity. Remember, assistance is not a failure. It's an act of mutual respect. The most private parts of our life often carry the most shame, but they deserve the most kindness. You are not unclean. You are not less than. You are simply human, living in a body that has changed, and you deserve to feel clean, confident, at peace. Every time, every day. No one outgrows the right to dignity. If you've seen yourself in any of these 7 habits, please remember this. You are not dirty. You are not failing. You are simply navigating a body that has changed with time, and that takes courage, not shame. The truth is, hygiene in older age isn't just about looking clean. It's about comfort, health, and honoring the vessel that has carried you through a lifetime. Each step toward better care, whether it's using lotion, changing socks, or asking for help, is a quiet act of self-respect. You haven't lost your dignity. You're learning how to protect it in new ways. If this video brought you insight or comfort, we invite you to like this video to help others find it. Subscribe to True Senior Wisdom for weekly reminders of healing, care, and strength after 60. Share in the comments. What small hygiene habit are you ready to improve? Not out of pressure, but out of love for yourself. Your voice may gently guide someone else today, because aging isn't about doing less. It's about doing what matters, with intention, grace, and gentleness.